Our top story this morning, up to 100 new fever clinics will be set up across the country as part of the Morrison government's $2.4 billion plan to help protect against the coronavirus.
Let's go live to Canberra now, where we're joined by Trudy McIntosh. Trudy, take us through the details.
Pete, it's a big cash injection from the Prime Minister, deliberately designed to deal with the health concerns around this coronavirus outbreak. I'll take you through the main things we know so far of this announcement. Up to 100 fever clinics will be established right across the country. They'll be able to deal with 75 patients a day at a cost of around $200 million. There will also be free video GP consultations. That will allow patients not to have to go into GP centres, help medical staff treat them via Skype and FaceTime. And then thirdly, this was flagged by the Prime Minister late last week, but there will be this $30 million public information campaign designed to combat the spread of misinformation that we have seen, in particular on social media. The Health Minister also has been trying to calm concerns after what we saw yesterday in Melbourne, in particular, those long lines outside of hospitals as people were waiting to be tested for coronavirus, in many instances forced to wait for hours. Here was the Health Minister saying that people really need to calm down here.
Our best selves are the people we were through the bushfires, the support for each other, and that's a part of it. At the same time, the government's providing the funding, the structure and the assistance to give people the best possible healthcare. And of any country in the world, we're as well prepared as all of them.
The Royal College of GPs have broadly welcomed this package that we will see announced later today by the Prime Minister, but they have raised concerns about the mixed messages we have seen from the states and also from the Commonwealth when it comes to who should be tested.
Look, it's caused a lot of confusion and a lot of anxiety because each of the states have different levels. So if you look at what happened yesterday, you've got one state saying go and test everyone who's got a cough or a cold, and you've got the rest of Australia saying unless you're at risk of being exposed to the coronavirus, then that's when you should be tested. And again, that causes anxiety. I mean, patients are wondering, am I being taken care of?
And this $2.4 billion package is just the beginning. Don't forget, we're seeing this multi-billion-dollar economic stimulus response finalised and should be announced in the coming days. So, Laura and Pete, expect to see more there when it comes to the support for small business.
Yeah, just the beginning of the spend. Trudy, thank you. Let's look at the markets now. Wall Street has bounced back overnight.
Let's go live to our business reporter, Edward Boyd, for all the latest details. Ed, what does this mean for our markets today?
Peter, it's a positive sign for our market. We're expected to, the ASX 200 is expected to rise 0.6% this morning. We fell 4% yesterday. Just shows how volatile a time it is with shares at the moment. Wall Street had a pretty good afternoon session. It just closed an hour ago. The stocks over there are up 5%. So good news for Australian investors. We're going to see a positive start. We're expecting at least to see a positive start on the market this morning, up 0.6%.
Okay, hopefully we see plenty more of that green right behind you, Ed. Appreciate it. Thank you so much.